Hi, my name is Lisa. I am the dermal aesthetic therapist for Skin Store. I also do the product recommendations. I did my 4-year study program at Isaac Cotton's Academy in Stellenbosch, and I love everything skincare related, of course. And all the products mentioned in this video will be available on our website at www.skinstore.co.za. So I'm going to go over everything pigmentation related, things like the causes, how to prevent it, what to use if it's already there, because pigmentation can be such a tricky one to get rid of. Let's talk about what causes pigmentation. So the first one would be post-inflammatory hyperpigmentation. These are usually post-acne marks. And then another one would be sun exposure. So being in the sun without sunscreen or not reapplying your sunscreen. Then there is genetic, so whether you have a genetic predisposition to getting pigmentation. And then of course hormones, hormonal imbalances or changes, like for instance falling pregnant can increase your chances to develop pigmentation, or going on birth control pill, that can also increase your chances, but it's not a given. It is just a something that can be a contributing factor. Certain medications can also increase your chances of developing pigmentation. And then of course, any kind of trauma to the skin can also increase your chances. So for instance, picking at acne, as I mentioned, that is called post-inflammatory hyperpigmentation. And then waxing, of course, can also increase your chances because you're causing trauma to the skin. Here's how to prevent pigmentation, because as I said, preventing is better than treating the pigmentation, because pigmentation can be quite stubborn. In my opinion, it is one of the most stubborn skin conditions to try and improve. So 2 things that I would recommend doing is 1, wearing a broad spectrum SPF 50 every single day, and 2, reapplying it during the day as well if you are actively out in the sun, running or swimming or any kind of outdoor activities. So it basically just depends on your skin type or your preference when it comes to SPF. I prefer for my oily skin, I prefer the La Roche-Posay and Thelios UV Immune 400 50 plus. So it's a UVA and UVB broad spectrum SPF. As you can see, it is my favorite. And then for a more dry skin, or if you have more balanced skin, you can also use this one if you have combination skin. So this is combination and oily skin. And then if you have more dry skin, or your skin is balanced, so it's not too dry, it's not too oily, then I'd recommend using the La Roche-Posay and Thelios 400 UV Immune 400 SPF 50 hydrating cream. And then for post-inflammatory hyperpigmentation, so post-acne marks, I do recommend using something like the Effaclar Ultra Concentrated Serum from La Roche-Posay. It's a nice, quick absorbing, lightweight serum, and you just need to use it 1 to 2 times per week. And this is what it looks like. I don't recommend this if you have very dry or very sensitive skin. I mostly recommend this if you have oily or combination skin. Those are also the 2 skin types that are more prone to getting acne and acne marks then after the acne. And then for something that you can use every single day for post-inflammatory hyperpigmentation, and also as a spot treatment if you do have little pimples coming out on your skin, or even for congestion, you can use the La Roche-Posay Effaclar Duo Plus M. This is my favorite daily moisturizer as someone who is quite oily and congestion prone. So this is what it looks like. This one is a little bit more moisturizing than the serum. So the serum is a little bit more treatment focused as well. This one is a little bit more everyday moisturizing focused. You can of course use this one 1 to 2 times a week, and then the other days you use the Effaclar moisturizer, but do not use them at the same time. And then something I would recommend if your skin is a little bit more on the dry side or a little bit more on the balanced side, so again, not too oily, not too dry, is the La Roche-Posay Cicaplast Balm B5. So this is a wonderful repairing balm, especially for post-acne marks, so post-inflammatory hyperpigmentation. You can also use this on your acne marks if you have combination skin. With oily skin, I do recommend testing it first, because it is quite a it is a little bit more on the thicker side. So the repairing and healing ingredients it contains is zinc, panthenol, madecassoside, especially because it is both repairing and soothing. And then just to clarify, this is not a treatment for pigmentation specifically. This is just for post-acne marks or post-inflammatory hyperpigmentation to keep the skin calm, so that it doesn't form more permanent marks or scars. So this is not a targeted pigmentation like sunspot pigmentation treatment. So it is considered safe to use as well during pregnancy, but with anything pregnancy related, I always recommend asking your doctor first, just to be on the extra safe side of caution. It can also help with melasma while you are pregnant or breastfeeding, but it does not help to treat existing melasma. It just helps to calm down the inflammation associated with melasma. The La Roche-Posay Pure Vitamin C12 Serum can also be used during pregnancy. It can be used to help even out the skin tone and reduce pigmentation. But of course, please consult your doctor first before using it when you are pregnant or breastfeeding. And then, as always, please remember to double check ingredient lists before you buy new products or try new products, so that you can see exactly what is in it if you maybe have an allergy to something. And when you do start using new products, please remember that it can take anywhere from 4 to 6 weeks to really see a difference. This is obviously product specific, so some products work a little bit quicker than others, some ingredients work a little bit faster than others. Please remember to also consult your doctor if you want to try new products or you're starting to use a new product. And then prevention is always better than cure. So remember to wear your SPF every single day and comment your best or favorite product down below that you use for pigmentation.